my assessments today, I found that you have generalized gingivitis. If you don't mind, I'll tell you more about it. It is the inflammation of your gums, is your body's reaction to plaque, which forms on your teeth throughout the day. And that plaque has bacteria in it, and your body's natural immune response is to fight it. So, in fighting it, your tissues get inflamed, and so it's very important to remove that plaque daily, if not, twice daily, and it is really beneficial also to come in for care every 6 months to get professional care to have plaque removed and calculus, which can form on your teeth from the calculus hardening from saliva. So I will show you some toothbrushing methods and some flossing methods. From when we disclosed with that bright pink solution on your teeth, we found that 45% of the surfaces of your teeth have plaque on them. So I can teach you some methods to help reduce that, and it will help just with your overall oral health, with reducing, the gingivitis and things like that. So I'll start out by showing you this toothbrushing method. And before I would have the patient show me how they brush, how they floss, I would ask them how often they brush, how often they floss. But I'll teach them the modified Bass method. The modified Bass method. So have the toothbrush turned up at a 45-degree angle to the gums, so like so. And then brush very gently. You don't need to use a lot of pressure or friction, just enough to get the plaque removed, like so. And then you'll flick it downwards to get the plaque away. And try to overlap from the area you were doing before to just get rid of the most amount of plaque as possible. And flick down once again, like so. You do that all around. You do that outside, and then on this surface, and then also on the inside, like so, and flick away. And then for this area right here on the bottoms, it is very, it's narrow, so it's harder to reach in there. So I'd recommend with your toothbrush using it like this, and you can still get the benefits and flick it away, like so. So this is an area where a lot of calculus forms, since your saliva flows from there, and also right here you have some salivary glands that flow, so a lot of people have calculus in these areas, so really important to get those areas good. And then I'll show you this flossing method. Works really great to get rid of plaque. So you wrap the floss around your middle fingers until you have about a couple inches, and then you can use either your pointer finger or your thumb to floss. Might be kind of hard to show on this on this model. So gently saw in. Do not snap it in because it can cause something called floss cuts, which is not very comfortable. So just very gently saw it in, and once you're in, you don't have to saw anymore, and then just go backwards and forwards a couple times, wrap around the tooth very well to get as much plaque out of there as possible, and do it on the other side, C motion as well. And then I would have the patient demonstrate those back to me. And so some modifiable risk factors for this gingivitis are, and just your oral health in general, is good self-care. So just daily self-care, and I'd recommend brushing twice a day, flossing once per day, to just improve your oral health overall. What was I saying? So in addition to daily self-care to help improve your oral health, smoking is another contributing factor to gum disease. From smoking, it causes a lack of oxygen flowing in your bloodstream, so it can make it harder for your gums to heal. And gum disease is also proven to be to progress faster in people that smoke. So it's a very important thing to keep in mind. So yes, I would definitely emphasize brushing and flossing daily, coming into the dentist every 6 months so you can get the professional care that you need to remove calculus and biofilm. And then we can also, make sure you don't have cavities forming. From our risk assessments, we found that you have moderate caries risk due to your recession with your gum tissue and from your plaque formation, and you have some areas which are decalcified. It just means that it's just not as strong as normally. It's just softer teeth. So using a fluoridated toothpaste will help a lot with that. I would recommend using Crest Pro Health Total because it's good for anti-cavity, plaque control, just numerous things. It's just a really great product. I also found from your risk assessment that you have a high risk for periodontitis. So I'd ask the patient if they know what gingivitis is, periodontitis is. It's important to remove your plaque every day so it doesn't progress to periodontitis, which is if you have plaque on your teeth and your body's constantly fighting it, it's gonna, to save itself, it's gonna make the bone supporting around your teeth in a way disintegrate, and that can eventually lead to tooth loss. So I have another product I would like to recommend to you. It's a Listerine product. So it's called Listerine Antiseptic. I can show you a picture of it here, and I'll also write it down for you to bring home so you can find it in the store. So a product like that. Let's see. And then I'll show you an image of how your oral health can progress worse. So here we have what health looks like. So as you can see, the gums are all the way up here. They're coral pink, very healthy. And here you can see they're a little bit red around the edges. It's not a very good picture, but it does some justice. And then here you can see there's some bone loss in the area supporting the teeth. And as time goes on, it can just get worse and worse. And soon you have some roots being exposed, which puts you at higher cavity risk. You do have some recession, so that means you have some roots showing. I think that is about it for today. So I'd ask them if they have any questions. And yeah.